doctors have been crying out about a shortage of staff and other factors putting strain on the healthcare sector. And many are asking if the National Health Insurance is implementable. The Solidarity Doctors Network says there's no trust in the government to make the NHI work. The government proposed a National Health Insurance in 2011 to ensure that rich and poor would have access to quality healthcare. Phase 1 was completed, but Phase 2, that was originally scheduled for 2017 to 2022, has not happened yet. Dr. Angelique Coetzee is a member of the Solidarity Doctors Network. Thank you for being with us, Doctor. Can you tell us what is the situation on the ground in public hospitals right now? Give us some of the challenges, and therefore how big would the leap be to this wonderful idea of a national health insurance, quality healthcare and universal coverage?
Good afternoon to you, Francis, and to all the listeners out there. Yeah, this is really a big problem that we are facing currently. Just to go one step back, NHI has been on the table since 2010, and if we look at even longer than that, where the idea started. So if we look at the current HR component of doctors in the public sector, we know that there's not enough doctors, especially specialists. There's not enough money to employ medical officers. There's not enough money to train registrars into specialty posts. So so there's a funding issue currently. Now, if we look back at and look at NHI is a funding model for healthcare going forward. Now, you mentioned a very interesting thing, that we will all have access to healthcare. But the truth is, currently, we all have access to healthcare. If you cannot afford a private medical scheme, you have access to our current healthcare system, to the public system. And I think here's where the problem is, because you have access, but there's not quality.
Yeah.
And we need to address that.
Isn't the idea that a national health insurance would bring in the funds, we'd all contribute, so therefore there would be more money? And when you talk about resources and specialists not being available, the idea is that the private sector would also play a role. So specialists would cut across public and private and not only be serving the rich.
So why is there not currently a public-private partnership with private sector and to do exactly this? If we look at the Competition Commission Health Market Inquiry, and we look at the data there, that was one of the things that we need to look at, we need to address. So what we now want to do is we want an overhaul of a system that is in any case supposed to give access to healthcare. There is supposed to be having public-private partnerships, but the distrust from public sector towards the private and vice versa is enormous. And we also saw with NHI that the National Department of Health, when they asked for beds in the private sector, the fee that they were willing to pay did not take all the expenses into account. So, it becomes extremely difficult if under an NHI, the government will be the only or the sole purchase of services.
Yeah.
So, you either take it or you leave it. And it can't be like that.
That is one of the big concerns, that the NHI will see the Department of Health become this huge centralized procuring machine. And I guess COVID-19 looting and corruption has not helped with that trust deficit.
Definitely not. Just to give you an example of the problems we are facing. Last week, Mark Haywood published an article around the Rahima Musa Children's Hospital. It's the biggest hospital, especially in Gauteng, and where that was stated, and we all know that Gift of the Givers dug a borehole a year ago when there was no water. It's now a year later. So just to sum up the problems that we are facing, and this is not unique to Rahima Musa Hospital. So currently, there's again lack of water in the hospital. So if you've got lack of water in any hospital, especially in a children's hospital, your disease rate or your infectious rate is going to go up. If you don't have flushing toilets, how can you run a hospital? And if there's no proper water in all the wards, that's the first problem. They also experience generator problems. And this is recently. I'm not talking about a year ago or 4. This is recently. So if the generators doesn't kick into a public sector hospital or any hospital, especially in a children's hospital, you have a problem of ventilators, because those neonates that's been ventilated, for them to have proper ventilation is of utmost importance. There is no proper incubators working. So this is just a part. So this is a generator. Then poor sewage system. And the old problem again, the hospital is old, it's nearly 80 years old, so it's been blamed on the infrastructure. But for goodness sake, you know that this is an old hospital. Yeah. Why didn't you get DID involved?
And this is the same hospital. Yeah, this is the same hospital where we've seen the images of pregnant women sleeping on the floor. Has an opportunity been lost? COVID-19 funds put the spotlight. COVID-19 put the spotlight on hospitals, and perhaps the funds could have resulted in a general upliftment of hospitals. I mean, at the time, I remember the pandemic just brought this all to the fore. Rats in a hospital in the Eastern Cape, and then of course, we've got these problems that you've been speaking about. I mean, if you could ask for something from government, what should be done? Where's the starting point to fix this thing?
People are not going to like me. So where do we start? We fire the people who are not doing their jobs. We start firing people. You have to have the right qualification for them to do the job with enough experience. So we fire incompetent people. That's where you start. Then, this is one of the other problems, even in Rahima Musa, and I know it's all over the public sector. You get your IT system working because you have to measure what is happening. So you know, it's terrible if a hospital doesn't even have proper phones that's working. There's not really, you can't have faxes. There's not IT infrastructure because something happens and no one is really holding accountable. So we need accountable people. We need to get competition. So if we can get competition in the public sector with the private sector, remember, not everything is good with the private sector as well. So if we can start getting competition and people start to vote with their feet, and there are public-private partnerships, not radical economic transformation partnerships, but real partnerships that is there for the best outcomes of patients, the quality of health will improve. If we train our nurses properly, we will have better outcomes. If we make the curriculum for undergraduates less silo-based, but more integrated, and make them understand how it works. All of that, you don't need an NHI system for that.
So Dr. Coetzee, let me end with this. Why is there nothing like that? Why aren't you getting a Medicare or a Netcare hospital partnering with a public facility nearby and sharing knowledge and sharing training and learning from each other, and the private sector willing to pass on some skills? Why is that not happening at all?
A very good question. I know for a fact that solidarity the Foundation of Professional Development, all of those people and other organizations have been tried fruitlessly to start to train people in your nurses or doctors in the private sector so that we can use these skills between public and private sector. But it's been refused up till now. So I presume that there's going to come court cases going forward because we need
refused by whom? By government?
Doctors. No, I think the private sector is going to start asking questions. Why are we not allowed on tertiary level to provide a university for doctors, a proper training for nurses, in the private sectors?
Okay.
Currently, there are some of the hospitals that train nurses, but it's about 16 nurses. How can you use that? And on top of it, those nurses need to work in public as well as in private sector. So there's this public-private intervention is not there. And we have to have that going forward. Otherwise, healthcare will always stay that. You will have access, you can walk in, as it is currently, but the quality of care, and it's not in all the public hospitals poor, but on average, let's fix the distrust. Let's make sure that there's enough specialists, train the doctors, train the nurses, make sure there's money to pay for essential services and healthcare for all of us out there. The government owns it to its citizens.
All right, let's leave it there. Thank you so much for your time tonight. That was Solidarity Doctors Network board member, Dr. Angelique Coetzee.